Hi, I'm Allie. I am the nursing student today. I will be giving a Rocephin IM to my patient. I will start with the 6 rights of medication. So right patient, right med, right time, right dose, right route, right reason, and then also right documentation. I will start by checking my MAR. It's Rocephin 1 gram IM every 12 hours for 6 days. I will have to reconstitute and calculate the dosage, and then it will be a Z-track for administration. In order to get the 1 gram, I will administer 2.8 milliliters of the diluent into my medication vial. That will then reconstitute it to 1 gram per 3 milliliters. So I will inject 3 milliliters of the Rocephin into my patient. I will perform hand hygiene. I will then check both vials, make sure there's no cracks, no precipitation. I will verify the expiration dates. And then I will remove and cleanse both vials. I'll start by removing my needle. I will insert it into the medication vial and withdraw 2.8 milliliters of air. I will then withdraw this from the vial. Place the air in the diluent and administering it, making sure not to get any in the liquid. We'll then invert the vial and withdraw 2.8 milliliters of the diluent. Then making sure there is no air in there. I will withdraw that and recap. I will then re-cleanse the medication vial. Uncap and add the diluent. We'll then recap and gently roll the medication between my hands, making sure not to vigorously shake. Once it is thoroughly mixed, I will uncap my needle and once again pull back 2.8 milliliters of air and adding that to my clean vial. Giving that a second to dry and adding that to my clean vial. I will then invert the vial, making sure to only get the medication. Which can be a bit tricky. Perfect. I will then recap this needle. It is now dull from being punctured so many times. I will discard of that and get a clean needle. Now we are ready to go into our patient room. I will perform hand hygiene and put on gloves while also identifying my patient using 2 forms of identification. Can I please get your name and date of birth?
Skip Rocker, 1/1/1972.
Hi, Skip. Do you have any allergies I should be aware of?
Celebrex.
Okay, I do have that in my chart here. Skip, I'm going to be giving you a reconstitution of Rocephin, which will help fight that bacterial infection. I can either give it to you in your outer thigh or your lower hip. Which area would you prefer?
Lower hip.
Okay. I will be using the Z-track method today. With your lower hip, you can either be standing or standing or laying down. Which one would you prefer?
Standing.
Okay. Do you have any questions for me before I get started?
No.
All right. I'm going to clean your injection site here, starting at the inside and working my way out. I will then uncap my needle. With the Z-track method, I will take the side of my hand and pull away from the injection site about 1 inch to 1.5 inches. I will invert at a 90-degree angle, aspirating for 5 seconds. If there's any blood return, I will immediately remove the needle. Because there is not, I can then start to administer. I will quickly remove the needle and letting go of the skin in order to trap that medication inside. I will then recap my needle and enter this information into the MAR.